Hi everyone, it's Dr. Sheena here. Today we'll be dealing with the topic root canal irrigants. So root canal irrigants and intracanal medicament are two important steps in actually root canal treatment. That is because our root canal is a three-dimensional complex structure which consists of lateral canals, accessory canals other than the normal main canal, and these canals can harbor microorganisms. So the file system which we use is not able to reach this lateral canals and accessory canals, and we need irrigants so that it can pump through this dentinal tubule and remove the microorganism. So what is a major obstacle in achieving the primary objective of cleaning and shaping? As we all know, the root canal is very complex. They consist of actually dentinal tubules. The dentinal tubules are connection of the pulp to that of the periodontium. So what happens is like these dentinal tubule consist of microorganism. So we will be doing the cleaning and shaping only in the main canal with the help of files. So in order to remove the microorganism from the dentinal tubule, we need solutions so that it can penetrate deep into the dentinal tubule and wash out this microorganism, providing a sterile environment. Next is so the first is complexity of root canal system. Second, there is large amount of dentinal tubule. Third, these microorganisms invade in the dentinal tubule. So when we do an instrumentation, there are small smear layer, that is a mixture of the dentinal shavings, microorganisms, organic, inorganic substances form a soap-like structure that form on the surface of dentine. So and also the presence of dentine as a tissue where the microorganisms can attached to the surface, making them a substrate. These forms obstacle for achieving the primary goal of cleaning and shaping of the root canal. So what is the goal of an irrigant? The irrigant should able to cause a gross debridement of both smear layer, microorganisms, etc. And it should have a broad spectrum antimicrobial property because there are large spectra of microorganisms present in the root canal. It should able to dissolve the tissue like pulp tissues in the tooth, which consist of organic materials, and it should not be toxic because sometimes it might actually go beyond the root apex, so it should not actually cause any toxicity. It should have lower surface tension. It should act as a lubricant, and very important, it should act in the removal of actually smear layer. So these are the goals of irrigation. So what is a factor that affect the efficacy of root canal irrigants? First is the quantity of irrigants. So according to Shielder, he said that at least 1 to 2 ml of irrigant is actually required, and this often actually flushes the debris, smear layer, etc. So each irrigation we should actually include 1 to 2 ml of the irrigant. Next is frequency. It is directly proportional. More the frequency of the irrigant used, more will be the cleaning of the root canal taking place. Third is the concentration. Grossman did a study where he used 5.25% of the normal sodium hypochlorite in a dampened dish, and he actually put the pulp inside that, and he found that it took about 20 to 30 minutes for actually the complete dissolving of the pulp within that 5.25% of the sodium hypochlorite, that is 20 to 30 minutes, right? Next is actually the temperature of the irrigation solution. We know that in our clinics we do not actually heat the irrigants. But what happens when we heat the sodium hypochlorite that we commonly use? So it was found that when the solution is heated at the temperature of 21 to 37 degrees Celsius, it has the capacity to dissolve organic as well as the collagen material that is present in the pulp. So temperature increase often causes the good debridement of the necrotic pulp that is present in the root canal. Next is length and time of contact. Necrotic pulp dissolve readily when we give more of a contact. So longer the time of contact, longer will be the capacity to dissolve the necrotic pulp taking place. And the level of observation, always the apical third is the area which is the most constricted area. So what happens is like least of an apical debridement is seen in the apical third of the root. These are the steps, main important points that you need to keep in mind. Next is the gauge which we take as an irrigation needle. We know that there are large amount of gauge size like 23, 24, 27, 30, etc. Preferred is like 28 or 30, that is having a very smaller diameter. Since smaller the diameter, it can easily penetrate, we can easily penetrate into the root canal. So larger the diameter like 23, and it is inversely proportional. Diameter more means number will be small. Okay, larger diameters are 23 and 24. They're less effective or efficient in actually irrigation process. Smaller, like you can see 30, that is 30 gauge files are very effective. So when in endodontic practice, just memorize it. In endodontic practice, which we commonly use is 27 gauge needles. The question is, most important criteria in using the irrigation solution. First is volume of irrigation, thickness of the syringe, concentration of the irrigants, none of the above. It is of course the volume of irrigation which we use. If we use higher concentration of irrigants, it might have a deleterious effect on the periapical tissue. That is one. And if it is not using in a proper volume, instead we are using high concentration, the amount of contact will be less. So the thing that requires is actually the volume of irrigation, which is an important criteria for a irrigation solution. Next, which of the following needle is used for irrigation? So as I said earlier, it's like 28, 30, etc. preferred, but endodontics which we commonly use is 27, right? If 28 is there, you can actually give 28. Next is the classification of irrigant. Normally, we need to know some important irrigants that are actually commonly used in our clinical practice, and that from that, like sodium hypochlorite, chlorhexidine, EDTA, these are the areas from where questions are being actually used in the aspect of irrigants. So there are two type of irrigants, chemical irrigants and the natural products. Chemical irrigants is of actually two type. You can memorize it as CAT. C for chelating agent, A for antibacterial agent, and T for tissue dissolving agent. So what is tissue dissolving? The commonly used irrigant, sodium hypochlorite in our clinical practice, is tissue dissolving. It has the capacity to dissolve the pulp. One. A is antibacterial. So bacterial effect is actually used by the chlorhexidine, because we use as a mouthwash, we use it as an intracanal irrigant. That is because it have bacterial property, bacterial property. Next is C, chelation. Chelation means they remove the calcium along with them. Okay, that is EDTA. Just memorize these important three terms: chelating agent, antibacterial agent, and tissue dissolving property. Chelating agent is like EDTA, antibacterial property is by chlorhexidine, and tissue dissolving is by sodium hypochlorite. Now, what are the natural products which we use? That is because the chemical products might actually develop antibacterial resistance. To prevent that, we are actually going into natural products like the green tea extract, triphala, propolis, etc. So talking about the first one, sodium hypochlorite, that is otherwise called as tissue dissolving agent. So early it was actually called as a bleach, and we used to actually use it as a disinfecting agent or a bleaching agent. And it was during the 1920s, it was first used as a primary root canal irrigant. So as you all know, the first important property is tissue dissolving. So it means that the pulp contain organic tissue, it dissolve the organic tissue. First important. Second, only it have that antimicrobial property, right? Concentration usually varies from very small 0.5 concentration to 7%. But in our clinical practice, we use about 5.25%. That is, it ranges from half 2.5% to 5.25%, etc. And it is very good in removing the organic tissue, very important. Another important term is Dakin solution. You can it is DAKINS. Dakin solution is actually 0.5% of sodium hypochlorite. When we mix it with a bicarbonate buffer, it is called as Dakin solution. This question has been asked for NEET PGMDS, so please concentrate on this topic especially. Unbuffered sodium hypochlorite has a pH of 11. So, but the buffered like Dakin solution have a pH of 9. That is very important. Dakin solution have a pH of 9 because it is buffered with bicarbonates. by unbuffered have a pH of 11. So what is a mode of action? Three important property shown by sodium hypochlorite is saponification reaction, amino acid racemization, and chloramination reaction. That is SAC. Saponification, amino acid neutralization reaction, and chloramination reaction. So what happens is like, this is sodium hypochlorite, NaOCl. The NaOCl, when it contacts with the water, get converted into NaOH and HOCl. This HOCl is the material which is stronger and causes the action, causes saponification. All the reactions is caused by HOCl. And further it can get dissociated to form OCl minus. But the stronger agent is HOCl. Keep in mind. First is saponification reaction. Saponification reaction means the fatty acid that is present in the pulp or the microorganisms, it react with the sodium hypochlorite. It forms, saponification means soap is formed. Soap and glycerol is formed. So that is saponification reaction. It acts on the organic material fat particles and it convert it into soap and glycerol, that is alcohol. That is the first reaction. Next is amino acid neutralization reaction. The sodium hypochlorite react with amino acid to form water and salt. Saponification, it is soap. Amino acid neutralization reaction is like salt and water is formed. Chloramination reaction, what happens is like, when the chlorine get dissolved in water, it comes in contact with the organic matter to form hypochlorous acid. That is the early thing which we've studied here. This is the hypochlorous acid, this one HOCl. So it further act on the organic substance and it causes the reaction to take place. So hypochlorous acid, that is HOCl, is more stronger when compared to the hypochlorite acid. That is very important. Hypochlorous HOCl is more stronger when compared to the hypochlorite material. So the question is like, the commonly used root canal irrigant which was used for irrigation wounds during World War I by Dakin. So you know that Dakin means Dakin solution, that is sodium hypochlorite, that is buffered sodium hypochlorite. That is very important. It is the buffered sodium hypochlorite with bicarbonates. Now, what are the method by which we can increase the action of sodium hypochlorite and decrease the action of sodium hypochlorite? As I said, heating increase the action of sodium hypochlorite. Time of contact often increase the action. More the volume, more the action. All these increase the efficiency. What decreases the efficiency of sodium hypochlorite? First is the storage time. More the storage time, it acts for a longer period of when it is kept for a longer period of time, its action decreases. Next, when it comes in contact with certain chemical agents like EDTA, its action is decreased. So that was all about sodium hypochlorite. We need to know the concentration, pH, what are the various action, HOCl reaction. HOCl is more stronger than the hypochlorite. All those need to be kept in mind. And the other names of sodium hypochlorite like Dakin solution. That was all about the tissue dissolving agents. Next is antibacterial agent. As I told earlier, antibacterial agent is chlorhexidine gluconate. So we know that chlorhexidine gluconate is a positively charged material. So what happens is like, they actively or passively get into the microorganism. We know that microorganism is negatively charged. So they attract each other. It goes and stick on to the surface of this microorganism. There is complete disruption of the cell membrane taking place. There is leakage of actually the adenosine phosphonucleic acid, etc., and complete cell lysis take place. So this is actually the mechanism how which there is destruction of the microorganism. So chlorhexidine is positive and the microorganism is negatively charged. So chlorhexidine go and attack the phosphate group of the microbial cell wall, and there is change in the osmotic equilibrium, and there is release of all that adenosine nucleic acid, etc., which causes the destruction or the cell lysis to take place. So talking about the concentration, there are various concentration of sodium, chlorhexidine. So there is low concentration and higher concentration. Higher concentration is what we use normally, that is 2%. 2% is used as as an irrigant, very important, 2%. When we use the normal low concentration, what happens is like it doesn't form a layer on the tooth. So it does not produce the property called as substantivity. Very important. Substantivity is actually a property where the action of the material is seen for a longer period of time. So the higher the concentration of actually chlorhexidine, that is 2%, what happens is like there is take this material get taken up onto the tooth surface and inform a layer, and there is slow release of the material for a longer period. So substantivity, it's a very important property of chlorhexidine. That was all about chlorhexidine. Talking about EDTA. EDTA is actually a chelating agent. Chelating means it has the capacity to remove the, if this is actually the tooth and pulp, if we apply the material inside, it can remove the calcium from the dentine. So it is called as actually the chelating agent. Now there is a alteration in the composition of EDTA, EDTAC. The addition of cetavlon, which is an quaternary ammonium compound, led to the production of EDTAC because it had a greater germicidal activity and also greater inflammatory potential to the tissue. So just remember, EDTAC is just a modification of the EDTA, the normal solution which we use as an irrigant, where cetavlon is used, it is a ammonium product. So it has antimicrobial and anti-inflammatory property. So what happens is like normally this sodium hypochlorite have the capacity to chelate with calcium ion as well as magnesium ion. So what happens is like when we actually apply to the tooth surface, it start to slightly corrode the dentinal surface, and it is said that along with that it release the microorganism which is actually attached, as I said earlier, dentine acts as a substrate for the microorganism. So when this dentine also removed by bit, the microorganism also get removed along with that. What is EDTAC? This was one of the questions that was asked 2 years back. So as I said earlier, EDTAC is a combination of EDTA and very important cetavlon, right? Next, EDTA, which is an active ingredient in root canal preparation, has its principal action in first, decalcification of dentine, dissolution of the necrotic debris, lubrication of the canal during instrumentation. All this property. First is, as I said, decalcification of dentine. If the question was like sodium hypochlorite, no. Sodium hypochlorite does not have the action of decalcification, but it have property of dissolution of the necrotic pulp, and it also acts as a slight lubricant, but not as a decalcification agent. Decalcification agent is the typical feature of EDTA. So all this are the answer for EDTA. Another important solution that was asked in NEET PGs is MTAD. It is a recently introduced irrigation solution, and it is a combination of D4-doxycycline, A4 acid, and a detergent is there, right? So MTD is actually recently added. It is a combination of materials which can bring about synergistic action to remove large amount of microorganism, and it was effectively found that the microorganism is able to remove the deadliest Enterococcus faecalis. So talking about slightly about Enterococcus faecalis, E. faecalis is actually a gram-positive microorganism. So in the case, some people do root canal treatment, but afterwards the patient comes again with pain. So we started studying what is the reason. One of the reason is like there is a persistent microorganism called as Enterococcus faecalis. These irrigants or the intracanal medicament which we place is not having any action against Enterococcus faecalis. So we need material which can remove this persistent reinfection causing Enterococcus faecalis. So MTAD was shown to have action against E. faecalis or Enterococcus faecalis. And MTAD commercialization as BioPure MTAD. So you need to actually memorize, it consists of actually the It consists of the doxycycline, very important, an acid is there, and also a detergent is there. All three are there, right? And what is tetracline? Tetracline, this is another name which we actually commonly come in contact normally when we deal with the questions. Tetracline is similar to that of MTAD, but two irrigant differ in the concentration of the antibiotics. Doxycycline is 150 mg for tetracline. For MTAD it is 50. MTAD it is more of doxycycline, 50. But tetracline means it is a newer material, so the concentration will be less, 150. 150. Sorry, the concentration will be high, 150. And the detergent which is used is twin 80 for MTAD and propylene glycol for tetracline. So these are the difference. So talking about MTAD, the MTAD have 50 mg of the doxycycline which is used, but tetracline has 150 mg increased, the concentration increased. Next is it contain as I said, it consists of a detergent that is twin 80. Twin 80. Here it consists of tetracline. Right, sorry, it consists of propylene glycol. So just memorize these two difference in tetracline and MTAD. So coming to the last portion of the irrigation. Irrigation, you need to know the irrigant activation methods. It consists of manual and machine activated. Manual means which we do by ourselves using our hands. First is the needle which we use, right? Needle means we'll be applying the needle and we will be pushing the material inside the canal. There will be actually dissolution of the organic and inorganic substance from the root canal. We use the normal side vented or end venting. Venting means normally the needle is opening at the apex, needle like this, right? So what happens is, like, when in the root canal, when we push the irrigant outward, there is a chance of extruding outside. So in order to prevent that, the newer needles are having an opening at the side. So here it is closed. This is called a side vented. So the solution will come like this. So it will hit the canal to the perpendicular direction, so it does not cause the extrusion of material outside. There are brushes called as endo brushes and navi tip, which is used for cleaning the canal. Manual dynamic activation method is there, where we use a katta parcha. We'll put the solution inside that and we will give a continuous activation of hundreds cycles for actually 30 seconds. 30 seconds we'll give a continuous agitation method, that is the manual dynamic agitation method. So these three are manually, which can be used with the help of hand. Machine assistant include, first of all, rotary brushes are there. That is, we attach it to the rotary endodontic machine and it will rotate at the rotary speed and it clean the canal. And sonic and ultrasonic materials are there, and pressure alternating device. You need to know the names actually. Brushes include our Radle brush. Radle brush is a canal brush. The name are different, so it has been used for rotary. And sonic means there are sonic and ultrasonic machine, that is based on the frequency of current that actually use. In sonic, it deals about 2 to 5 hertz of actually heat like energy is used, while in the case of ultrasonic, 20 to 25, 20 to 40 frequency power is actually used. And in another PPT, I'll be explaining the mechanism of action of both these. And it contains respisonic and endo activator. And ultrasonic, just read the examples. Pressure alternating device is endo vac and rinse endo. So this was about the devices that is used for doing the irrigation. So this is all about irrigation and irrigation methods. Just go through the needles, go through the three or four important irrigants that is commonly used in the irrigation techniques, and just the name you need to memorize. Nothing extra is actually commonly used in the previous question papers. Thank you. Hope you understood that the class. We'll see you in the next class. Thank you.